Hi, I'm Dr. Rob Cordwell, I'm a GP here in Sefton, and I'd first like to reassure everybody watching this that we are open and we are here for you for any medical concerns you might have. We've been working differently in practices across Sefton to make sure that we can keep seeing patients in the safest way possible because we have been facing a challenging period. So join me for a day in the practice so you can see how we're working. 7:30 in the morning, this is when I arrive at the practice to open up and get the building ready for staff and patients. Once I've opened up, I log on to the computer and deal with any documents, medication requests or laboratory results that have come in overnight since I was last here. It's 9 o'clock and it's time for morning surgery. We've seen an increase in demand recently, partly because of the increasing complexity of our patients, partly because of the backlog that we've seen as a result of the pandemic, which we're seeing across all healthcare settings, and partly because we're seeing a rise in viral infections over the autumn and winter, which we always see but seem worse this year because people have started coming together again. To cope with increasing demand and so that we can help as many patients as possible, most practices have adopted a triage system, which means you might be asked some questions by the reception staff before you are put through to an appointment with a clinician. That's really so that we can offer you the best type of appointment with the most appropriate clinician for your particular case. This might be with a GP, an advanced nurse practitioner, a practice nurse or a physio. That might be a telephone appointment, it might be an online consultation, it might be a video consultation, or it might be a face-to-face appointment with a healthcare practitioner. If there's a clinical need to be seen face-to-face, then you will be seen face-to-face at your practice. We do still have some infection control measures in healthcare settings, so we ask that you remain socially distanced, wear a mask and wash hands regularly. Where telephone or video appointments are appropriate and where the patient agrees that that's appropriate to deal with their concern, we can often fit 2 or 3 of those types of appointments in the same space as a face-to-face appointment, so it enables us to deal with many more patients. It's now 12 p.m. and I've finished morning surgery, so now I will pick up any questions that have come in from patients or admin queries during the morning. If there are any home visits to vulnerable patients, this is where I would do them. It's now 1 o'clock and I have a meeting with other local doctors to discuss how we best look after cancer patients in our area. At lunchtimes we often have meetings either with staff or the practice manager or other clinicians in the area to discuss what's going on, what we can change and learn from each other, and also to just organise the running of the practice. It's now 2 p.m. and time to start afternoon surgery. This afternoon I'll be seeing some of the patients who were triaged this morning and they're coming in for either a telephone or a face-to-face appointment with one of the practice clinicians, along with patients who've just booked in for the afternoon surgery. It's 5 p.m. and the end of afternoon surgery. There are still some patients to be seen who contacted us during the day with problems that can't wait till tomorrow, and then there will be tasks from patients who rang with queries or anything else that's cropped up during the afternoon that needs to be dealt with. It's 6 p.m. I've finished dealing with patients for the day, so now I'm logging onto the system to issue any medications that have come in during the day, to do any medication reviews, to look at the lab reports that have come in and letters from colleagues regarding patients that need to be actioned and dealt with. I'm also dealing with any emails that I've received during the day and have paperwork with insurance reports or letters for patients, that type of thing, all of which needs to be done. It's now 8:30 p.m, so it's time to lock up the practice and go home. Most GPs will take admin work home with them just so we can finish the work for that day and have a fresh start in the morning. I hope you've enjoyed spending the day with me in practice and have been able to understand how we're working differently to enable us to manage the increased demand we're seeing and help as many people in the best way we can. We're asking you to be patient and be kind to all staff in GP surgeries and across the health service. It is a time of unprecedented demand and we're all working as hard as we possibly can to help you.